I'm here with Ann Bruce, CST specialist for the Craniosacral Therapy Center of Charlotte. It's a pleasure to speak with you tonight, Ann. Now, Ann, how long have you been here?
In Charlotte?
Yes,
Oh gosh, I've been here probably for about 22 years.
22 years. Okay.
Yeah.
Now, where are you from? And did you originally work at another healthcare or wellness facility before coming here?
I'm originally from New Orleans, and yes, I did work at another facility before starting my own practice. I worked at a company called Body Heal, and it was a great place to work. They specialized in structural integration, but since my specialty was craniosacral therapy, there really wasn't a focus on marketing in that direction. And quite honestly, I had my own following, so I just decided to branch out on my own.
I love this for you and us, like I told you when we met. So, what led you into craniosacral therapy? Did I pronounce it right this time?
Craniosacral.
I keep saying sacral. Why do I want to change the name?
That's
Craniosacral. Say it correctly, TB. So, what led you into this line of work?
Well, I've done massage my whole life. I probably
Mhm.
started when I was about 5 or 7 years old, but I definitely started with the neighbor's dog, then the
Oh,
neighbor, and then the other people in the neighborhood, then my family. And so I've always done massage my whole life. It's always been like a love thing for me, because I've seen people get so much healing from massage. I remember in my 20s, I used to work on senior citizens and volunteer. To come to their homes and just work on them. And I have seen legs that were ravaged with diabetes that were black turn flesh
mm,
tone, And so then after my youngest went off to college, I had to start all over again. I was an empty nester. My husband's career was in full bloom, and I had been a stay-at-home mom dealing with some traumatic brain injury issues. So I decided to go off to medical missionary training. And so it was there that I found out that what I do with massage therapy is not really it's not really normal. So I one of the modalities that they teach you in holistic wellness and medical missionary training is massage. And so when the director came to experience my practical in massage, he said, "Oh, I didn't know you were a massage therapist." And I was like, "I'm not." And so she said, "Oh, you need to go get your license right away." And because I really think that this is how God's going to use you. And I've always wanted to do it. And so I did. But as I mentioned, I have traumatic brain injury. And so it was really bad at one time, going in and out of rooms, not knowing I left, not recognizing my husband, my
mm.
children, asking the same question 1,000 times and not being able to read and write. And at least my writing was like chicken scratch, but I had no comprehension. So the medical missionary training program, because it's an academic program, I really pushed myself to get through it, but I didn't know if I could get through massage school because that's a science-based program, a
Right.
lot of memorization, and it's not as easy as you think it's going to be. And there's a test to become licensed. And so I went and received 6 weeks of craniosacral therapy. I went twice a week for 6 weeks. And at the end of it, I had enough cognitive function to go and do the massage training class. And so I fell in love with it immediately.
So, did it when you did the class on it, but it was something that you also experienced,
Oh,
right?
yeah. Yeah, I experienced it before I did the class. And I got my massage license October 3rd of 2023. And then October 4th of 2023, I was taking craniosacral therapy.
Wow. When did you have the brain injury?
It actually started like a lot of brain injuries. It started in childhood. And
Wow.
so, yeah, I grew up with three brothers, and on Saturday morning, we would do the WWF, right? And so back then, there were these guys called the Fabulous Freebirds. So my brothers were the Fabulous Freebirds, and I was the Junkyard Dog. And so they clotheslined me one day,
Oh no.
and oh, I did it to them. It's what we did on Saturday morning back then. But this time my head hit the corner of the dresser. And so what was noticed by my parents over the next, 12, 18 months, change in urine flow, it slowed down, change in temperament. They thought, oh, maybe she's, going through puberty early, and also a change in my gait. And so even so, those are noticeable changes, but explainable back then. But
Right.
it wasn't until I had a surgery and I went under anesthesia that that dormant brain injury that I've dealt with all my life. Many people have ADD, ADHD, and they think that's what it is. But very often it's a brain injury that's causing those symptoms. And so after the surgery, about 12 to 18 months, all those symptoms developed. Because if you have any kind of brain injury and you do surgery, you need to ask for the least amount of anesthesia, because if you're under for a long time, your brain's not making those neural connections.
Right, right. So was craniosacral therapy a thing when you had that brain injury?
Craniosacral therapy has been around since the 1950s, and so it's not a new therapy. It's a therapy that was practiced here in the United States, but also in Europe. But it's one of those exclusive therapies because it's always been cash pay and it's always been relatively expensive.
I like how you explained everything. And I like that you have a close relationship with your experiences so you know what your patients need. Now,
Mhm.
you've explained it in simple terms. Can you explain what's happening in the body during the sessions when you give therapy?
Yes, yes. So craniosacral is a light touch massage modality. So there's no rubbing or kneading or poking. It is a very light touch massage, and it feels like I'm really not doing anything. But when you're on the table, you begin to feel subtle shifts in the body. You begin to feel calm. You begin to feel movement. You begin to experience pain relief. And a lot of people honestly fall asleep. And they don't notice the difference until they're up after the session, because I have each person walk up and down my hallway 7 times to help their body really recalibrate and figure out where everything goes, because a lot of things have moved around.
Right. Now, what surprises people the most, and what do they learn about it once they have therapy with you?
I think what surprises people the most is the power of the nervous system, because craniosacral therapy is designed to calm the nervous system. And once the nervous system is calm, then that reduces or eliminates inflammation enough so that the immune system can kick in and the body can do what it's designed to do, which is heal. Now, most people only think about the healing in terms of physical healing.
Right.
But the immune system is designed for mental, spiritual, emotional, and physical healing. So we get people. I may get someone who's just come out of a hospital after unsuccessfully attempting to take their life.
Uh,
And we can work with them for 6 weeks and actually balance out their nervous system and help them to go on and live productive lives. Because very often that's the problem. That's one of the problems. I might get a football player, a professional football player, who's coming in because he doesn't want to be on injured reserve. He doesn't want his team to know he's injured. And so he'll come to me, particularly the concussion protocols, because a lot of
mm,
the concussion protocols are really insufficient to have someone play. And these men are playing for their livelihoods. And so they'll come to me for a concussion because I am a concussion specialist. I have different specialties in craniosacral, and concussion is one. So I might get a professional athlete. In fact, about 2 weeks ago, I had a Major League Baseball player who was a pitcher, And he just came in because he wanted a head massage. I was like, I don't do head massages. I'm a craniosacral therapist. But he says, I just want to relax. And so I was like, I promise you'll be relaxed and you'll feel good. Because he had a lot of pressure in his head. And there are a lot of people walking around with pressure in their head. Well,
Right.
by the end of the session, the pressure had gone from his head. He was completely relaxed. And most importantly, his range of motion in his shoulder was better than it had been in 10 years. And so people come for, that autoimmune issues. If someone is having a flare up and they don't want to be out of pocket for 3, 6 months, they'll actually come to me for intensives. I mean, you just name it. People are just surprised at what the immune system can do, what the neurological system can do. So that's the biggest surprise because many people think I do all kinds of stuff, and I don't. I do one thing. I calm the nervous system so it can reduce that inflammation and get your immune system active.
Get it active and in check.
Yeah, and fighting for you.
Yes. Now, what needs did you see in this area, and how has that response been? Like you said, you just did a baseball player, but
Mhm.
deepening inside the community, how has that response been?
I think one of the most powerful experiences I've had within the African American community are people who have asthma.
Mm,
So, I've had a couple of clients who've been on asthma inhalers that, the pumps that they have, and they've done the pumps for some of them all their lives, 3 times, five. I think this one lady, she had 5 inhalers and
mhm.
she was doing them like 3 times a day. I didn't know you could have 5 inhalers. Or she was doing, or did she have 3 inhalers doing it 5 times a day? But she had a lot of
That was a
inhalers.
lot.
That was a lot, but she had had asthma her whole life. And then after one 2.5 hour session, she did not need her inhaler
Mm,
for 3 weeks. And
that's
so
wonderful.
it is wonderful. It's so powerful, in fact, that we are beginning to get together to do a study on asthma for to help people get off of inhalers because they don't think about asthma as as a neurological issue, but a lot of asthma is an anxiety induced or stress induced. And we also have an executive wellness program that attorneys and doctors and big time business people come to eliminate stress and anxiety, because there's a lot of stress when you're way up there.
Right. I would not have attributed asthma to this therapy. That is unreal. Now,
Even fibromyalgia. I had a client who's had fibromyalgia for 40 years, and they suffer from fatigue and pain all over. And the day after her first session, she was able to go and work for 12 hours to get her house together for Christmas because she was having guests come over, and she got off her pain medication in the morning within a couple of weeks.
so you're like a miracle worker, in my opinion. Now, what should a first time client expect physically and emotionally when they come to get therapy from you?
They should expect to feel relaxed. They should expect to feel safe. And they should expect to have results in my practice in the first session. And a lot of people say, how can you tell people they're going to have results in the first session? Because nobody says that. But that is
Right.
what has been true for my sessions and my practice so far. And my old mentor used to say, it's because I've been through so much physically myself that I just know how to connect to people on a cellular level so that they can feel safe. And when you feel safe, your immune system will just kick in so beautifully and allow the healing to take place.
Right. You have such a calming voice, and everything about you is soothing. So that's
Thank
a plus.
thank you.
Now, you're welcome. And you answered one of my questions. Do people usually feel results immediately or over time? What is that time frame like?
It really depends on the person. It depends on, some people say it depends on how long it's been going on. That's not necessarily the case in my practice. But what I will tell you that's true in every craniosacral practice is it has to do with whether or not you are ready to heal.
Right.
And I say that, and also let's start with some very basic things. If you're in good physical condition and you have an acute situation, it's not, then you're probably going to heal pretty quickly. If you're in good physical condition and you have a situation that, let's say it's acute or it's chronic, but you've got some emotional baggage,
Mm,
but you're willing to deal with it, it's going to take you a little bit longer. And
right.
let's say you're in good physical condition and you don't, and you've got some, you're in good physical condition and you've got some emotional issues. It may be chronic, your situation, it may be acute, but you're not willing to deal with those issues. It's going to take you a lot longer and maybe never.
Wow.
So, this is a good example. I had this client who flew in from Mexico to see me, and he was had a lot of chronic pain all over his whole body. I mean, obviously, if someone's coming in from Mexico, they've got some issues,
Right, right.
but we were able to get rid of about 90% of his pain, and the 10%, and this was over 4 days, and he came for like 2.5 hours, 4 days in a row, and he was his pain in his hip would not go away.
Mm.
And I looked at him because my clients call me the body whisperer. And I could just listen to his body. And I was like, oh, you have something, you have someone that you're absolutely furious with. They've done something and you're angry and you will not forgive them. And I was like, and that hip isn't going to stop hurting until you let this go. He goes, I'm not forgiving him and I'm not letting it go. And
Mm.
again, barely touching this man and he's screaming for Jesus, okay?
Oh.
He's screaming so loudly that his wife runs into the room, opens the door and says, "What's happening?" And I tell her and she goes, "Okay." So apparently she knew what it was about. So, so in that case, I couldn't do anything because a lot of what people don't realize is emotional issues that are unresolved become physical issues,
That's
right?
right.
And even psychosomatic diseases eventually manifest as real disease. But let's say you're not in good physical condition and you have an acute or chronic situation, it's going to take you a little bit longer than the healthy person. But you're gonna be fine. But let's say you're not in good physical condition and you've got some emotional issues, but you're willing to deal with them. It's going to take you a little longer, but you're going to get there. But let's say you're not in good physical condition, you've got some acute or chronic issue and some emotional issues that you are not willing to deal with. I refer you to somebody else.
So all business is not good business, even in your line of work.
Well, I when I say I refer them to someone else, that just means that it's going to take them a very long time. So I'm known for getting very quick results.
Right,
And so, but there are people designed to take care of those people because
right.
all of us have issues that we can deal with in 3 weeks, and then some issues it might take us three
That's
years.
right.
And so I like to send them to people who have that is their gifting. You know how some people are just like super patient and
Mm.
then whatever you give is okay, right?
Right, right,
On my table, I'm much more, hey, this is a place of healing. If you're
right,
ready to heal, then we can move forward. But if you're not, let me give you to someone who's going to take good care of you. And
right.
that's very important to me, to be honest with you, because there are times when, let's face it, we have all had times where we just could not address some emotional pain or trauma in a short period of time. And to that extent, I have people who come for anxiety, and then after their third session, they have no anxiety. And so they'll call me and they'll say, I'm having an anxiety attack because I don't
Wow.
have any anxiety. So sometimes the healing can happen so fast. That's also disconcerting.
Well, I feel like you have discernment, and then you don't want to waste their money or their time if they're not ready yet. So that
Yes,
speaks to
absolutely.
you as a healthcare professional, that you're not just in it for the money. And we will get to the passions in a little bit. Now, my
Mhm.
next question: how has everything changed since you've been practicing, especially here in Charlotte?
Um, there are more people saying that they do craniosacral therapy and
Hmm.
they really don't have good training.
Oh, wow.
And it's sort of like myofascial release. If you look at anybody's website, they say, "Oh, I do myofascial release."
Mhm.
Well, there are a couple of standards in myofascial release where you get results consistently. That would be like structural integration, Thai massage, craniosacral therapy, and Barnes myofascial release, right?
Mhm.
But if you don't have those types of trainings or similar trainings to those, then the people are not going to get the results. And so, similarly, in craniosacral therapy, there are standards. There's biodynamic and upledger. And both of those modalities have been researched and clinical studies have been provided. And there are just a lot of people who are teaching craniosacral therapy that really don't have the expertise. And so a lot of people go to get help and they're disappointed because they don't get the results.
Right, which sets you apart. Just the
Yeah.
fact that you're not willing to me, just take any amount of money, even if the treatment's not working, because they're not ready. They're not ready or open-minded to go through with what you're offering, if that makes sense.
Yeah, yeah.
What are most clients trying to address other than the asthma, fibromyalgia? What are the main things that you're seeing?
I see quite a few concussions. I
Mhm.
see quite a lot of people with anxiety. I see a lot of people with stress, and I see a lot of people with chronic pain. Chronic pain from spine surgery, whether it's fusion from their cervical spine or their lumbar spine. So I would say chronic pain, like a lot of chronic neck, back, shoulder pain. I see people for endometriosis and menstrual cramps because these are very serious issues. And so
Right.
I would say those are probably the most common uh, ones that I see clients for. And of course, autoimmune issues.
hmm I like that you said menstrual cramps because, again, one would not think craniosacral therapy
Hey,
would
you
be.
got it.
It only took 20 times, and so now, do your clients usually come from referral or word of mouth?
I would say 90% of my clients are word of mouth. We do not advertise. We have never advertised because, we just we keep our books full with word of mouth. Um, oh, there was something else I was going to say. But recently, we've been getting referrals from ChatGPT, which we have no
Oh,
idea how ChatGPT knows who we are, but apparently they do. And they've been sending us clients.
wow. ChatGPT is everywhere. It's probably listening now. So, what's the biggest misconception people have about what you do?
I would say that it's energy work.
Hmm.
Right? And because people always say, oh, is this energy work or is this like Reiki? And I always say, anytime somebody touch you, it's energy work.
Right,
I don't care what they're doing. If they're hugging you to make you feel better because you've had a hard day or you've lost something or someone that's important to you, all of that is energy work.
right,
So I think people need to understand that whenever you touch someone, you're experiencing energy from them. Now, I do not go to, I will say this, in my practice, I do energy work to the extent that I pray before I work on people while I'm working on them and when I'm done.
I
So
love that.
if they mean energy work from that perspective, yes. Now, having said that, I believe that there are some craniosacral therapists that have um, that do engage in energy work from different types of energies. But also, I would say talk to your craniosacral therapist and ask them, is it energy work? Because for some people, it's just very technical. I mean, we
Mhm.
have studies that other people can get the same results. And so it's proven in their techniques and everything. So I would say talk to your craniosacral therapist. And also remember, if someone is doing any kind of massage on you, they're moving energy in your body.
And that's something that most people will not understand
Well, but think
until,
about it. If you walk
right,
into a room and you see someone, you have a visceral reaction. Either it's
right.
good or it's bad,
That's
or
right.
it's or you're, either you're feeling open or you're feeling wary. And that's energy in that room. that you're
Right.
experiencing with that person.
You've said a lot, even you praying over your treatments. That is not something I've heard before.
I don't know that it's something everyone does,
Mhm.
but I that is something that I do because I think prayer changes things. And there have been all kinds of studies for I don't know how many years that prove that prayer, if you pray for someone in the hospital, um, even if they're not a believer, they tend to need less medication and have fewer incidences in the hospital. So that's
Right,
even when they're not a believer. So why wouldn't I?
right. I agree. Um, what do you what do you think some of the misconceptions come from? Like you said, Chat GPT sends you referrals, but and I'm not talking about Chat GPT. Like you said, this has been around for years, eons. Where do you think most of the misconceptions come from with it being around so many years?
I think many people think that it's new.
Hmm.
And so that's one of the misconceptions. And so they're a little, wary of trying it. And
Right,
so I think that's probably the biggest misconception. I think they don't realize that there are studies that really show the results of craniosacral therapy. And so I think they just don't know what to think. And
right.
there's so many people who have never heard of it. So it just takes people stepping out on faith in a way that's sometimes not comfortable.
I agree. What is the different demographics that you see? What are the age ranges? Is it male, female?
I would say about 60% of our clients are women, and about 40% of our clients are men.
Wow.
And that is exceptionally unusual in a massage therapy practice. Usually about 90% of the clients are women, right? We will
Right,
get our massages. But because of the stress release component, the anxiety elimination component, and the chronic pain, and that we're very successful at it, we get a lot of men. As far as age demographics, I would say the average client is probably between 30 and 70.
mm,
So we get some people in their, quite a few people in their 60s and 70s because we work with people who have Alzheimer's and dementia and Parkinson's and who've had strokes. And again, who've had chronic pains from, maybe they took a fall playing pickleball.
right, right. Now, how does craniosacral therapy help with dementia?
Well, one of the biggest problems with dementia is that the brain has waste that has not been circulated out. And
Mm,
so when we remember that all cells in our body produce waste, but when we don't receive proper circulation and proper oxygenation, then that waste cannot be eliminated from the body. And
right,
so what I do is I release fascia restrictions that are on the brain and the neck, also in the respiratory system, because that's a really big problem, not just for people with dementia, but I would say for about 60 to 70% of my clients have difficulty taking deep breaths. And
mm,
they don't know that they do until I actually open up their lungs.
right. That's crazy. Not saying, I'm just saying that, you never know what your restrictions are until you come into a specialist who's showing you, no, it can get better than this.
Yeah.
So, what what other clients would you like to see in your practice?
I don't know. I love my clients. I just feel like I get the right clients at the right time. You asked me about demographics. We don't get many African Americans in our practice
Mm,
yet. We get some, and they're all, everybody's word of mouth.
right.
Um, I would like to see, to answer that question, I would like to see more Christians in the practice. And I think what's interesting is that I've had someone ask me, uh, who is it easier to work on someone of faith or someone without faith? You know, so if someone's a Christian or someone who's not a Christian. And I say someone who's not a Christian because they just receive whatever it is I have to offer. They're not battling with whether or not God's going to do this or
Right,
not, you
right,
know? And so they're
right,
just like, just give it to me. Just
right.
make me better. And they're not dealing with whether or not they deserve it. So they're not going
Uh,
through all of these mental gymnastics. And they're also not wondering if I'm a witch. You
you're
know,
not a witch.
I'm not a witch. And because there are a few Christians who thought I was practicing witchcraft. I was just like,
That's crazy.
you know, you think that because your church doesn't have healing services or deliverance services. But what all I'm doing, you know, in many ways is just laying hands on people. I mean, I
Right,
have certainly techniques that are taught through craniosacral therapy, but I am believing for each person's healing. But I think it's so odd that we don't believe, you know, that there are a lot of Christians who don't understand about the laying on of hands.
right. Or their faith won't allow them to.
Yeah.
Um,
When Jesus did more healing miracles than any other kind while he lived.
I'm telling you, look at you.
Yeah, I'm
He
just
did
saying.
more.
I'm like,
Now, with the mental health aspect of it, would you like to see more mental health patients?
you know, I think I would, but I would also like to see their families.
Right,
You know, because mental health isn't just an issue that impacts that person, it impacts
right,
the entire family. And what I found is that when the family gets help, then it's kind of like, you know, how you go to a seminar and you get all this new jargon and everything, and you're excited about all these new techniques you're going to implement, and you go home and nobody knows what you're talking about.
right. Yes,
So it's important to connect, and they don't all have to do as many sessions as the person who is having the mental health issue, but they need to do enough to calm their nervous system so that
right,
they can interact with the person in a way that they're not traumatizing that person, and also they're able to deal with some of their trauma. And what I love about craniosacral therapy, a lot of my clients call it the lazy man's therapy. And so it's kind of like that scene in military movies. This is how I explain craniosacral. You know how in all the military movies, there's this scene, they take these kids through this horrible, torturous boot camp, and
mm,
then at the end of the boot camp, they come up to the sergeant and they salute him, and then they go off to the right. This is
right,
what craniosacral is like. Your trauma is going up to your conscious self, your subconscious self, and saying, hey, would this issue still be a problem for you today? Or are you kind of over it and it's just stuck in your body, right?
right,
And if it's something that you're over or you don't really care about anymore, then it sort of goes off to the right. If it's something that would still bother you and hurt you and you haven't processed, then it goes to the left. But
right,
in
right,
about 70 to 80% of the cases, when this stuff is coming up to your subconscious, 70 to 80% of those issues are going off to the right. And so what that means is that that 20 to 30% that you have left, you have a lot more emotional bandwidth to deal with it because you're
right,
not dealing with that other 70%. And so that's the reason people begin to just feel euphoric sometimes. You know, it's typically after like the third or fourth session, they find that they're more patient, they're more long suffering. They find that they can
mm,
hear criticism and not feel attacked. They
right,
feel that they can say, hey, I'm not okay with that or the way you handled that. I know you meant well, but what I need you to know is that I'm not comfortable with it. And so they can say that without blowing up at people. And
right.
so it's huge. So it's the lazy man's therapy to that extent. Yeah.
I love that because it's like a counseling session all doled into one.
Yeah.
Um,
without re-traumatizing yourself.
Right. I love that you made a point to say that too, without re-traumatizing yourself. Now, with your services, would you consider it a primary service, or should they have additional services on the
I
other
think
side of that?
it really depends on the person and where they are in their journey. I mean, how many times have you heard people say, I am over this issue with my dad or my mom, but I feel like it's stuck in there, even though it doesn't bother me anymore. Haven't you heard people say that? I'm over
Yes.
that, but I don't know what's wrong. And so there are a lot of people who have done a lot of therapy already. And so all of this stuff they've dealt with it, but it's stuck in their body. So when it releases, they have already done the work. I
Right,
had
right.
been raped 21 years earlier, and she came in, and within she came in twice a week for 6 weeks, and within that time the rape was no longer in her body, spiritually or emotionally or mentally. Now she had or even physically, she didn't feel the remnants of it lingering,
Mhm.
and she
Mhm.
had done a tremendous amount of work to get over it, and she knew she was over it, but she was stuck. And
Right.
so then she went, and then it just evaporated from her body. It's just mind blowing what happens when when the nervous system is calmed down and the immune system kicks in.
And it lets go of the trauma. Yes.
Yeah, and it lets go of the trauma.
So with craniosacral therapy, it is not a bandage like you're saying, but it is a treatment, a holistic treatment.
Yes, it's a non-invasive holistic treatment. It does wonders for chronic pain. And then I have clients who I may give craniosacral therapy to, but their body needs some more work. And so sometimes I may integrate structural integration techniques or Thai massage techniques, particularly Thai foot massage, because that has an amazing ability to release something that I may have been working on and it's stuck. I had this one client who was a gymnast in high school and college. She was in her early 60s and her shoulder had been locked for
Mm,
40 years. And
wow.
so after, I think it was like the third session, we were able to release the locked shoulder. We were able to give her a range of motion back in her neck and give her significant pain relief.
That's amazing.
Hmm.
With this, you are 100% hands-on, and you said something earlier in the conversation where the energy is transferable, basically. Once you've seen the number of patients you've seen with the number of experiences, I won't say issues, but experiences that they have, how do you get rid of the negative energy?
I don't really try to get rid of anything. I let the body do what it's designed to do.
I would like for you to tell our viewers where you're located, the length of your sessions, um,
Okay,
and
well,
your website information.
our sessions range anywhere from 90 minutes to 3 hours. It really depends on why someone's coming and how it's impacting their life, if they're coming from out of town. So a lot of things go into determining how long our sessions are. We're the only therapeutic intensive practice in Charlotte. There are probably about 8 craniosacral intensive practices around the country. Our website is www.cstcoc.com, as in Craniosacral Therapy Center of Charlotte.com. So cstcoc.com.